So this MSc in Reproductive Sexual Health and Research gives you a great grounding in sexual reproductive health, the principles and that subject matter, but also gives you a solid grounding in research methods and the practicalities of that.
I chose to study the MSc in Reproductive and Sexual Health Research because I thought it was a great way to spend a year between undergraduate and medical school and to learn a bit more about reproductive health, specifically within a research context, because I'm hoping to become an obstetrician-gynecologist and work in public health.
The mix of the class has been great, having midwives, doctors, social scientists, and all other sectors, demographers and all other sectors. We had students from Asia, Africa, like me, Europe, and then America, which was great, so that we could share various experiences.
This course is aimed at anyone who has an interest in reproductive health and in the research around reproductive health. That can vary from clinicians, midwives, obstetricians, doctors, through to people who are really interested in the social and qualitative aspects of this. What skills do you need? Well, you need an interest and a passion in the subject. You need to not be frightened of numbers, but it isn't something where you have to be an Einstein on numbers to be able to do, because there are also very strong qualitative and socio-political aspects to this subject.
The course has been special in a lot of ways, one of which has been that my professors and the faculty that I've had the opportunity to interact with are the people that I've read articles by for many years. So a lot of people that I cited in my undergraduate thesis are my professors and people that I get to interact with on a daily basis, and that is a really rich experience.
It's been great meeting lecturers who are well known worldwide, those who have done research for many other organizations, World Health Organization. It's been amazing meeting these lecturers whom we've been referencing about in our papers back home.
The school offers a lot of opportunities to be supported by faculty and by staff. One of the main ways is through your tutor. Everyone is assigned an individual tutor, and most of the time that person matches up with your research interests. And although my tutor is not my dissertation supervisor, we're very close and we meet almost monthly to catch up and make sure that I'm okay in academic things as well as just life at the school, and that's been a really special relationship for me. She also helped me to find my dissertation supervisor, and so I have good relationships with both of those faculty members.
One of the fantastic opportunities here at the London School is that as well as the high-class classroom teaching that you get, world-class classroom teaching that you get, you have the opportunity of the summer project. And the summer project really allows you to follow your own passion, develop skills, have fantastic mentors, and gain experience that is, I think, unique.
For my summer project, I'm looking at emergency obstetric and newborn care functions, as well as applying newly developed routine delivery care functions in low and middle income countries. I'm using this framework to examine the quality of delivery care in facilities in Kenya.
After this course, there are probably 4 main pathways that people take. So one pathway, we're a major research institute here, is the hardcore researcher, people who go on to do PhDs or applied science, maybe here at the school or somewhere else. Secondly, those who are from a clinical background and go back either to clinical or to public health, but in a more leadership position. Thirdly, we have quite a lot of alumni who go and work in United Nations posts. And the 4th pathway is with non-governmental organisations and international non-governmental organisations working in countries. So we have a contrast from people maybe working in the research end through to people working on the ground in countries in very hard to serve settings, all gaining skills from this course.
I definitely believe that I made the right decision by coming to the school. Taking a year between undergraduate and medical school to get a master's from the London School was one of the best decisions that I could have made.
Coming up to the end of the Millennium Development Goals in 2015, and we look forward to the future of global health, sexual and reproductive health really sits at the heart of that. What is happening not just for population and population growth, but also for women's rights, for the health of children and social capital. So the changes that have been made with HIV, changes that maybe still haven't happened enough for sexually transmitted infections, but also the broader social and stigma and many other issues around that. So this course covers those issues which are really at the heart of human development.